Looking at the ventilator-associated events for this particular patient, we can see that their oral care was all complete until about 7 o'clock. And if we drill down on that, for some reason oral care is no longer ordered for this patient. Once again, an opportunity for the clinician to have a conversation with the care team and get those orders clarified. We can also look at their inline suction status, which is currently not present. Once an inline suction catheter is present and detected and documented, that ring will go to green. We can look at their spontaneous breathing trial is crosshatched, meaning that that is not appropriate for this patient. And the reason why that's not appropriate today is they have a higher vasopressor requirement than would be safe to have a spontaneous breathing trial. The other ring that was red that turned to green is for their GI prophylaxis. It was not active or possibly not ordered up until about 8 o'clock this morning, and the ring turned green, which meant that orders were probably put in, and that is now active for this patient. The next goal that we'll take a look at is their ventilated associated events. Looking at this, we can see that there is some missing information for the head of the bed, hence the orange outline around that particular ring. However, that's also cross-hatched, meaning that head of the bed is contraindicated for this patient. And if we want to take a look at why, we can see that the patient is on spinal precaution, so it would be contraindicated to have their head of the bed raised. The other thing that we want to take a look at for this patient that is red is their GI prophylaxis. And we can look at that and see that that currently is not in active order. Once again, an opportunity to have a conversation to try to see if that's not appropriate for this patient at this particular time, or if an order needs to be put in for that.